Hi, welcome back to Everyday Behavior. This is the second lesson in our series this month, and this month we are talking about ABA therapy. Today we're kind of addressing what some frequently asked questions are for individuals, parents, or families that are considering ABA therapy. So what exactly is ABA therapy? I talked a little bit about the scientific foundation and the history of ABA therapy in our first video. But like I said, ABA therapy is a type of therapy or a type of treatment that is often used in children that have been diagnosed with autism. Now, ABA therapy can apply to a wide range of disorders or diagnoses, including ADHD, Down syndrome, or any kind of developmental disability in children. However, insurance typically only covers ABA therapy for children who have been diagnosed with autism. So specifically, there's been a lot of research on treating the deficits of autism or the specific deficits that children have that have been diagnosed with autism using applied behavior analysis or these types of treatment approaches. It's used to increase language and communication skills. It's used to increase attention, focus, memory, or academic skills. It's used to improve a child's social skills or play skills, as well as to decrease problem behavior. So all of those are things that children with autism typically struggle with, but they're also things that individuals with ADHD or with intellectual disability also struggle with. However, like I said, who qualifies for ABA? Insurance in most states, not all, so you want to check your state regulations, only provides coverage for individuals who have an autism diagnosis. The younger a child is when they receive ABA services, the greater the long-term benefits. So children can receive ABA services at any age. However, the younger they are, that early intensive therapy tends to lead to the greatest long-term impacts. So children as young as 18 months or 2 years of age often begin ABA therapy. Older children also qualify for services, but you may not see as dramatic of an effect, and they may attend fewer hours due to their school schedule. ABA therapy is also considered an intensive treatment. So when we're talking how much therapy should they receive, children often attend a minimum of 10 hours of therapy per week, whereas some children may attend as many as 40 hours per week. So why do we want early therapy? Because the brain is developing at this age. Children, when they're young, there are all of these developmental windows or periods of time where the brain is primed or ready to learn specific things. And if we're explicitly teaching or intensively teaching these things in those developmental windows, children are more likely to acquire these skills. Whereas the older they get, sometimes those windows close. Also, children spend all day learning. But if children aren't learning from their natural environment, if they need that additional support in order to learn these things, they may need to attend therapy as much as 10 or 40 hours a week. And we recognize that this can be very intrusive to your daily schedule. However, the long-term benefits of the ABA therapy, if you get that intensive therapy for those 3 to 5 years early on, then you may not have to do as much therapy, or you may have less, your child may have fewer disabilities as they continue into adulthood. And so you may not have, it may be a lot of disruption early, but for fewer disruptions in the long run. Also, what will my child's therapy schedule look like? Well, that really depends on how many hours they attend per week. So if they're attending 40 hours per week, it may look very similar to a school schedule. However, if your child is only attending 10 hours per week or 15 hours per week, they may have appointments that are between 2 and 3 hours per session. Whereas those older children who have more focused ABA may be only attending for 1 hour appointments. Children often attend therapy 3 to 5 days per week. So if they're attending therapy for maybe 15 hours, they may have 5 3-hour sessions per week. Or if they're only attending for 10 hours, they may have, 5 2-hour sessions per week. So this is really dependent on the family's schedule. It's dependent on the ABA therapist. And it's also dependent on what your insurance will allow. Who will see my child? So ABA therapy is overseen by a board certified behavior analyst. This is typically termed a BCBA, who will oversee the case, and they're responsible for all of your treatment goals, for making sure that your child is progressing, for monitoring the data, for adjusting or changing the goals as your child progresses through therapy. The BCBA will provide some direct treatment, but most of the time they are observing or supervising treatment that's conducted by the registered behavior technician, or an RBT. An RBT is an individual who's had specialized training in carrying out interventions, but they don't necessarily know all of the philosophy or the why behind exactly what they're doing. They just know that they're supposed to do these protocols or these specific things in these specific ways. And the BCBA supervises them weekly to make sure that they're doing things correctly, to make sure that your child is progressing, and to oversee that treatment that's done by the RBT. Most daily sessions, your child will be seen by their direct RBT therapist. And then the BCBA will be meeting with you during evals, re-evals, for parent training, and for other collaboration. If you have any concerns, you can always express those to the BCBA or to the RBT. However, the RBT can't make any recommendations. They can only convey those concerns to your BCBA. How does your child qualify for ABA? So prior to the first appointment with your BCBA, your child will need documentation of a diagnosis, typically provided by a physician or a psychologist as part of a comprehensive assessment. And that documentation will need to come along with an initial request for an evaluation, so kind of a script or a referral from that pediatrician. So in order for insurance to cover ABA therapy, first you need a diagnosis by a psychologist or a physician. Then you need that script or referral from your pediatrician. And those two pieces of information are submitted to your insurance to request your initial evaluation. That authorization cannot be approved without that documentation. So it's really important when you first sign up for therapy to make sure that you have those things in place. Following that approval, then the facility will contact you when your child's name has come up on the wait list to schedule that initial assessment. That appointment typically lasts 1 to 2 hours, and they're going to ask a lot of questions about your child's history. They're going to interview you, and they're going to work with your child to find out what the best treatment goals are to start with. So they're doing an initial assessment to determine, where should we start with this treatment? And so, like I said, that's to establish those initial treatment goals. As your BCBA gets to know you and your child, they'll be reassessed every 6 months to come up with new treatment goals. And as they master out of goals, new treatment goals will be added within that 6 months as well. You may be asked to complete several rating forms, maybe in the office, or those may be sent to you virtually. And you want to come prepared to that appointment with any background information that might be helpful as far as your school IEPs or any other assessment or early intervention services that you've received. I hope that you found this information helpful. If you found this information helpful, I do encourage you to subscribe to any of our channels, whether that's a podcast, YouTube, Facebook, or Instagram. You can search and find us to have updated resources by searching for Everyday Behavior with Dr. Mary Ann. Thank you and have an excellent day.